Those suffering from addiction may feel like they don't have any options. It's a hopeless feeling.
That's true, but the professionals and caring staff at Pine Rest Christian Mental Health Services offer up hope, options, support, and much more. As I recently learned, it's a growing need.
The numbers aren't pretty. Cases of drug addiction, overdoses, and relapses are on the rise. Dr. Ryan Doyle, a psychiatrist at Pine Rest, has seen the growing numbers firsthand, with more and more people coming through his door.
I mean, the first thing we think about is really the pandemic. The numbers were already on the rise before that, especially overdoses, but have increased even more drastically since the pandemic. A lot of people that were in treatment got disrupted from that treatment. Programs closed temporarily. People were stuck at home, isolated from their supports. According to the CDC, there's more than 100,000 Americans that die every year from overdoses, and that's greater than the number of deaths from guns and car crashes combined. So we're looking at a really big problem.
Dr. Doyle says that opiates and the surge of fentanyl are some of the main causes of overdoses, and told us what to look out for if we suspect ourselves or someone we love is becoming addicted.
Usually we're looking at impacts in their functioning. So they're functioning at home, they're functioning at work. Are they neglecting responsibilities? Are they neglecting things that are important to them?
Let's walk through this, all right? How does Pine Rest help someone from day one? What's the first step that happens?
Well, I think the first step really is making that call, because we know that only about 10% of people per year that struggle with addiction are actually getting treatment, which is a really low number. These are treatable diseases, right? So making that call. Even if you don't know what level of service you need, we can walk you through that. And we offer services across the continuum of care. So things like hospitalization, we have a dual diagnosis inpatient unit. When I say dual diagnosis, I mean treatment for substance use, but also treatment for mental health on the same unit. We have a partial hospitalization program that's a day program with groups, and then you still stay at home and get care in kind of an outpatient setting. We have a detox program, we have an outpatient residential program, we have outpatient treatment, with psychiatrists that specialize in addiction and also counselors that specialize in addiction. So really, any level of service you can get here.
It isn't uncommon for relapses to happen, and Dr. Doyle stresses that addiction is a disease that affects your decision-making.
We know from addiction that's a disease. We know that from brain imaging. We know that from the biochemical changes we see in the brain. The main parts of the brain that are affected in addiction are the midbrain, which has like the pleasure center. We talk about the nucleus accumbens, which is involved in addiction, but also the frontal cortex, the part of our brain that's involved in decision-making and planning. So I think the hard thing for people to grapple with is, why are people continuing to use despite these negative consequences? And they feel like they're making a choice to do these things. But we know that our decision-making capacity is impacted by addiction, right? So that frontal cortex, that part of the brain that's expected to weigh pros and cons, to consider our value system, to make decisions, that's impacted. It's not functioning the way it should be in someone who's struggling with addiction. And that midbrain, that part of the brain that seeks instinctual drive, seeks pleasure, that part of the brain is overactive, right? So it's almost like we're stepping out on the gas without the brakes. It's more of like a compulsive drive to seek the drug, and may not be thinking about the things you would expect someone to think about when making those decisions. We're talking about addiction as a lifetime illness, right? When you think about it like chronic medical illnesses, like diabetes, people typically are living with diabetes the rest of their life, unless they have some very significant change in their lifestyle and their health. But we should think about addiction as a chronic disease, right? People don't just cure it, right? They're in treatment and they have to deal with it, for the remainder of their lives. So I think one of the things that we look at is staying connected with supports, whether that's outpatient groups, whether it's things like AA or NA, staying connected with counseling, and for some people it's medications as well.
And it isn't just a physical problem. Mental health plays a big role as well.
There's a bidirectional relationship between addiction and mental health. So a lot of people struggling with addiction also struggling with mental health problems that could also be getting treatment that we can provide here. And the same thing is true the other way, that people with mental health problems are more likely to have problems with addiction. So really getting help in both of those areas is really important.
Well, we are blessed here in West Michigan to have such a fantastic resource like Pine Rest to help those suffering through addiction. So if you or someone you know needs that help, please contact them today.
And as you heard, that really is the first step, making that call. For you or someone you know, you want to learn more about Pine Rest Addiction Services, you just go to pinerest.org/addiction. Or you can just bust out your smartphone and take a picture of the QR code. It'll get you a link to get you right to them. Or pick up the phone, 866-852-4001.